the cleanse itself as a soluble in insoluble fiber. If you do some cleansing, you buy it in the drugstore, it's only laxative. You're able to remove your bowel normally, but you're not able to cleanse your blood impurities. That's why we have a product that is so unique and clinically proven and studied, because it has a soluble and insoluble fiber, as well as it brings your pH level into alkalinity. They are worried because if you take the product, you will have ankylosis or alkaline. So do not worry, because 80% of what we eat nowadays is more acidified and 20% only what we eat is only alkaline foods. As we age, so mahina na metabolismo mo, wala ka na siguro ehersisyo, so you're suffering from stress or prolonging the stress, leading for oxidative stress. So better for you cleanse as well, because lifestyle kasi ng tao na so wala nang, especially nowadays po, sa bahay ka lang, so whatever you grab this food, so maraming preservativo, junk food, so maraming mga siguro chemicals with that product or instant food, so it's bad for you. You know what? The colon has no property of metabolism. It's only a septic tank. It's your storage bank. So you have to clean it with a broom. That's why while taking the cleansing, it has a soluble and insoluble fiber. So it cleans your colon in abnormalities as well, in leaving the environmental factors that your organs functions normally, as well as the secondary effect. You're able to eliminate the toxins and the heavy metals that stays in your blood. That's why as long as you live, as long as you eat, you have to cleanse.
Kahangahangang katangian ng isang mahusay na karunungan ay ang paggamit ng pinaka-natural sa mabisang produkto matatagpuan. Positibo sa lahat ng bagay, sa physical, emotional at spiritual, sa ganahan sa buhay, ang hangat dinuman. Ang kalusugan ay kayamanan. May kayamanan sa kalusugan. Magkaroon ng pagkakataon, tulungan ang bawat isa, na ang bawat pamilya maiwasan ang karamdaman. Isang bagong henerasyon, harapin ang hamon ng buhay. May pag-ibig, tunay na kapayapaan, tagumpay at pagkakaisa sa lipunan. Ang kalusugan ay kayamanan. May kayamanan sa kalusugan. Ang kalusugan ay kayamanan. May kayamanan sa kalusugan. Ang kalusugan ay kayamanan. Ang kalusugan ay kayamanan. May kayamanan sa kalusugan. Double life.
afternoon and good afternoon. Okay, so good afternoon to all parts of the Noblelifers na nandito po nakasama namin with our time zone na nandito kami sa Pilipinas, but however on some part of the Noblelifers na nandyan sa New Zealand, UAE, good evening na po sa inyong lahat dyan. And good afternoon pa lang sa ibang parte din ng parts ng ating Noble Life family. Okay? So, flex naman natin dyan. Ang dami na ng mga viewers natin dito at nandito po tayo ngayon sa ating FB Live. And ako po ang inyong host for today. I'm Johanna Incontro. And I'm telling you that you're just keep on sending your link. Okay? Link lang. Pasa-pasa lang po sa ating mga katropa, kapamilya, and sa ating mga ka-berks at dabarkads. Ayun. And flex natin po yung mga viewers dyan and especially po sa ating mahal na presidente. Ayan, to our beloved president, good afternoon to you, ma'am. And kamusta naman po dyan sa Singapore? Ayun. And our president is none other than Madam President Lila Bailon Macapinlac. Ayan. So kung ano na po natin dyan, i-flex na po natin ang mga ka-viewers. Ayan, nandyan na sila. They keep on tagging and also to our management team na nandun din sa iba't ibang parte ng branches natin sa Noble Life International. So, good afternoon po sa lahat. Okay, and we have here, bago po tayo mag-proceed sa ating topic for today's event, which is the lung cancer and how to prevent it, we have some announcements first. Yay! Ayan, ano na ba ang nangyayari dito sa Noble Life International? Okay, number 1, we have Detox to Zumba, the ongoing event here natin. And we have bundles and eto guys, kailangan nyo na po i-avail ang mga bundles na to. Groovy na tayo with the Zumba. Avail the bundles. Napakaganda dahil meron po mga freebies na kasama dito. Yon, meron mga pa-t-shirt and ang kagandahan dito ay meron siyang raffle promo. And this gonna be nationwide here in the Philippines. Okay, so bili na po kayo ng mga ticket nyo para maka-join na po kayo sa ating Detox to Zumba. Okay? Colon cleansing lang ang ating gagawin dyan. And aside from that, we also have our travel incentive. So guys, ang gagawin natin dito ay keep on partnering with your friends there, yung mamimit natin sa Zumba natin. Okay, keep on sharing. Ayun, and kailangan lang din natin na makikipag-friendly sa ating mga ka-dance groovy dyan. Kaya kailangan natin din ipopromote din sa kanila or sa lahat po ng mga Noblelifers that we have travel incentives with a 3 days and 2 nights. All expense paid and napakaganda po ng ating itinerary dito. Okay? So guys, avail na po kayo or kailangan nyo na po maging qualified dito sa ating travel incentives promo. Okay, next is we also have here, yan, abangan po natin ang ating chat with the doctor. Okay, ang ating next na topic is managing hypertension. Okay, so alam natin na ito ay napaka-silent killer din to. Ito, kailangan natin malaman at magiging aware tayo sa ating pagtaas ng ating blood pressure. Okay, so abang-abang po natin by next Saturday. Yan na naman po yung ating segment dito. Chat with the doctor with Dr. Orteza. And also, next is, ayan, kailangan din natin abangan ito. Ito, very important din sa atin to, ang ating tinatawag na getting fatty liver. Ayan. So, ito guys, ang mga tips natin para ma-prevent natin ang pag-being fatty liver. So, kailangan natin ay ma-attend din ang mga talk na ito dahil po ay napaka-importante po ang ating topic na ito. Okay, so with our Dr. Cerilio Espina. Okay, so hindi na natin patatagalin dahil excited naman tayo for today's segment natin dahil ito ay alinsunod sa events program ng ating DOH, which is this is a month for a no smoking month celebrating by DOH. So ang atin naman ay napakaganda dahil naka-jive po tayo dito sa ating topic, which is lung cancer and how to prevent it. Ladies and gentlemen, our speaker is an Executive Director of International Council for the Standardization of Management for Bones and Joint Care, and which is in Beijing. Okay, and also he is a fellow and diplomate in a Philippine Academy for Anti-Aging Medicine. Okay, guys, no? Anti-aging, di ba? Ang galing. Okay, and he is also a president of and CEO of Fit Genes Philippines. Okay? So, fitness program ito. And also with this, our speaker is Gabe. He is an orthopedic surgeon and a sports medicine specialist, not only in the Philippines, but also in Dubai and also in Beijing, China. Okay, guys, without further ado, let's all welcome our very own Dr. Raylan Flores.
Hello!
Ayan, good afternoon to
Kumusta?
you.
Kumusta kayong lahat?
Ayan po.
Oo.
Sige, Doc, it's your
Thank
time
you,
to greet
Joanna.
our audience.
Yes, oo. Maraming salamat and I hope all of you are doing okay. At gaya nga ng banggit Joanna kanina, kung saan man kayo parte ng mundo, good morning, good afternoon, o good evening kayong lahat. I hope everybody's doing okay. At gaya nga na nabanggit, itong buwan kasi ng June is actually a no smoking month. Yan po yung we are increasing the awareness, one of the projects of the Department of Health here in the Philippines. So we are just partnering, kaya naisipan natin ang pag-usapan ay ang lung cancer. So let me just share my slides with you. Give me a second here. At teka lang, bakit wala yung aking slides? Nasa window kasi. Ayun ang aking slides. There you go. Nakikita ba ang aking slide? Teka lang. Yan. Okay? So, let's start off. Leading cancer sites. Alam mo, the incidence since 2010, the estimated top 10 new cancer cases for both sexes, one of the leading ones, actually the second one, is lung cancer. Now, mortality. When we talk about the new cancer deaths, this was way back in 2010, lung cancers lead the reason for kung bakit namamatay because of a carcinoma. Now, when we look into figures, the number of new cases for 10 most common cancers, both sexes, and the number of new deaths, though leading ang breast for both men and women, lung cancer is still the second one leading na parehong evident sa babae at saka sa lalaki. Now, what are the symptoms of lung cancer? There are a lot of symptoms that might one experience, but let's look into them. So, chronic cough, ibig sabihin ubo ng ubo na hindi talaga nawawala at hindi gumagaling. We also have bloody sputum, or you technically have blood and phlegm. Another one is weight loss o pagbaba ng timbang, and not just weight loss but anorexic, meaning the chances of you wanting to eat nawawala, kaya nga walang ganang kumain. Now, sometimes they may have back pains, but with this, we really do have to examine them kasi karamihan naman sa nagkakaroon ng back pains, abay muscle ang problema. So kahit sino man at one point in time, me included, have experienced back pains, but it doesn't necessarily mean that just because you have back pains, automatically you have lung cancer. So, hindi naman ganoon yan. But that's the reason why we would want to examine once there are back pain, especially yung hindi nawawalang pananakit. The next one would be fatigue. Madaling mapagod. Hindi yan yung dahil nagtrabaho na maghapon kung kaya't napapagod. Pero ito, we're just talking about a few steps, a few flight of stairs, medyo madali nang mapagod. Nagbuhat lang ng konti, may ginawa lang kaunti, ayan na, napapagod na. So, we want to differentiate this from the regular workload that you do in the whole day at pagdating sa dulo ng araw, medyo napapagod kayo. Magkaiba po yung dalawang yan. Of course, sometimes we do see hoarseness or in some cases, nahihirapang lumunok or dysphagia. Sometimes, we see some shape changes sa mga daliri. Ano ibig sabihin yan? Hypertrophic pulmonary osteoarthropathy. Kung mapapansin natin ang ating mga daliri, abay, yan ang normal na itsura. Ngunit pagka ganito, medyo parang lumolobo yung dulo ng daliri. Yan, maaari may problema ng iba. Of course, with cancers, the thing is, we really don't know who will get cancer or who will not get cancer. But the idea is, we would want to, as much as possible, decrease what we call the risk factors. And risk factors are two. You have your modifiable and your non-modifiable. Ano ibig sabihin nun? Aba, yung non-modifiable, maski anong mangyari, wala na tayong magagawa. Andyan na yan, ayan na yan. But for the modifiable ones, these are the things that we literally can do something about it. So, first and foremost, kaya nga ito ang primary gusto natin pag-usapan right now, it's smoking. Ang paninigarilyo. It's one, if not the topmost risk factor for having lung carcinoma. Now, let me just show you pictures. Pasintabi man po, I might show a few pictures here and there. But right now, you're looking at a pair of lungs. Yung nasa kaliwa ninyo, aba yan po ang normal na baga. I'm sure if you go to the market, mga namamalengke kayo, di ba? Nakikita nyo yung tsura ng baga. Although it's not as grayish as this, but they're actually literally around pinkish and smooth and fine. And of course, may hangin tama sa loob. But if you notice the one on your right-hand side, ay medyo dark, medyo kung mapapansin ninyo, hindi kumbaga sa lobo, fully blown yung mga air sacs kung saan nandoon yung pinakamahalagang oxygen na kinakailangan ng buong katawan natin. Now, majority of lung cancer is attributable to cigarette smoking. Alam nyo ba, a puff smoke contains more than 1,000 chemicals, more than 200 of which are actually carcinogenic. Of course, when we compare to non-smokers, those who actually smoke has a 20-fold increased risk of having lung cancers. Like I said, hindi ibig sabihin na ninigarilyo, automatic magkakalang cancer. At hindi rin sinasabing, hindi ka nanigarilyo, hindi ka magkakalang cancer. Remember, there is such a thing as what we call secondary hand smoke, which means kahit hindi ka naninigarilyo, pero yung lugar na nandoon ka, maraming naninigarilyo, o di kaya, yung kasama nyo sa bahay, naninigarilyo, the likelihood din na tumaas yung risk is always present. But of course, mas mataas talaga doon sa naninigarilyo. Now, what's a cigarette? If you notice, we mentioned about a couple of hundreds of other contents and ingredients. But if you notice in this slide, we're just talking about a few. And we do see from left to right, we do see cadmium, nakikita lang yan sa baterya, stearic acid na nakikita sa kandila, toluene, which is a industrial solvent, hexamine, which is part ng barbecue lighter, ammonia na panlinis nga ng banyo, may pintura, may methanol, may carbon monoxide, arsenic, which is actually a poison, methane, na nandyan sa create ng sa mga sewage system natin, acetic acid, and even butane. butane, yun yung talaga sa mga lighter na paninigarilyo. But doon sa dulo, on your right-hand side, on the upper hand corner, is nicotine, which is actually seen in insecticides. And with nicotine, the thing is it becomes rather addicting for a person. That's why it sometimes is quite difficult to literally take away smoking and have the person stop smoking. Yan po yung pinakamatinding dahilan. In the United States, passive smoking accounts for 3,000 lung cancer deaths. I'm not even saying cases, but deaths per year. And for quitters, they decrease their risk of having cancers, but it will take 20 years to undo what the smoking has done, which means that it depends on how much time you've actually spent smoking and how much cigarettes you actually spend in a day na paninigarilyo. Yan yung kaya tinatawag natin na smoking years. We usually would multiply kung ilang taong kayong naninigarilyo at kung gaano karaming sigarilyo. Isang pakete kasi sa isang maghapon, kinocompute namin as one, which means if you've been smoking for 20 years and practically smoke one pack in a day, that's 1 is 20, which means you have 20 smoking years in you. Which means, kung mas mataas pa paninigarilyo mo, kunyari, you do smoke, say, 2 packs in a day, 20 years, that's times 2. You actually have 40 pack years of smoking. So, ganun namin kinocompute yan para malaman natin kung gaano ba katindi ang paninigarilyo. Because kahit i-quit mo at one point in time, we sometimes look into the possible side effects. But of course, right now, we don't mind when you started. The point being is, as much as possible, we would want you to stop smoking the soonest possible time. And that soonest time is actually right now. And of course, it's quite similar to your exposure to radiation, exposure to asbestos, polycyclic hydrocarbons, arsenic, chromates, chloromethyl ethers. Itong mga ito are literally poisonous to the body. And like what I mentioned a while ago, there are some non-modifiable things that you can have. At yan ay kung sakaling may problema talaga sa pamilya, genetics sometimes plays a role sa pagkakaroon ng posibilidad na magkaroon ng cancer. Now, there are 2 types of lung cancers. There's the non-small cell and there's the small cell carcinoma. What's the difference? The non-small cell is basically anything that's not small cell. So you do have adenocarcinoma, squamous cell carcinoma, large cell carcinoma, adenosquamous carcinoma, and all of the other carcinomas that are possible. But we actually differentiate what we call small cell carcinoma because this is the classic one wherein large cell neuroendocrines are actually involved. And the problem is, it is quite aggressive. Mapapansin ninyo, if you do have had a chance to know of people who have had lung cancer, you sometimes wonder why this particular person who was diagnosed with lung cancer would live more than the 5-year survival rate that is usually given sa may mga cancers. And yet, you have another person being diagnosed around the same time, but literally not lasting the next 3 months or even 6 months at the most. And that's the reason why we would differentiate small cells from non-small cells because unfortunately, the aggressiveness na biyahe mag-metastasize iba't part katawan nandyan. Kaya yun ang pinaka-importante. That's the reason why we looked into and diagnosed by the process called biopsies. Mamaya I'll mention about it. To differentiate if your carcinoma is small cell or non-small cell. Now, how do we diagnose carcinomas? Chest X-ray is one of the things we do first. I'm sure most of you at one point in time have done chest X-rays because this is a requirement for employment, pre-employment, annual employment, etc., etc., etc. Why? We do determine a lot of things that can be a possible hazard in the workplace. So kung ikaw ay may problema, may infection, at kung ano-ano man na maaaring makahawa at makaapekto ng workplace, kaya ginagawa ng chest x-ray on a regular basis. But if we do have some of the symptoms that we actually would see, then we do a chest x-ray. And if you'd notice, like what I'm showing you here, there, I do have a cursor. This rather large white space is actually a mass already. Let me just differentiate and do terminologies. The thing is, it's called a tumor or a new growth or a mass occupying lesion. But it doesn't necessarily mean that it's automatically cancer. So we still need to differentiate. Tumor just simply means that there's a new growth or a mass in a particular area. The question now is we have to divide it if it would be benign, which means okay lang siya na nandoon siya, or malignant. Malignancy is now tantamount to carcinoma because the likelihood na bumiyahe at pumunta sa iba't ibang parte ng katawan is present. So in this case, there is a tumor in the left lung field, and we need to determine usually kung yan ay benign or malignant. What else? The more common things we do, because we would want to find out, lalo na kung hindi naman ganun kalaki ang mga nakikita natin, a chest CT scan might be ideal. Now, if you notice, this is an axial view of the CT scan. Ibig sabihin, pag axial ang hati, hindi po paharap, hindi pa gilid, kundi pa across ng katawan. So, right smack, you have your lung fields in black, your heart in the middle. Now, bakit ito lang yung binilugan at yung iba hindi? Because others might just simply be lung markings, ibig sabihin yung daanan talaga ng hangin, or they might just be blood vessels, which is normal. But kung may alanganing itsura katulad dito nakabilog, then the likelihood of a tumor might be there. Now, we would also do sputum cytology. And how would we do that? Pasintabi man po, pinapadahak namin sila para makolekta yung plema. Hindi laway ang kinokolekta, kundi plema. Bakit? Yung laway, dyan lang yan sa bibig. Yung plema nanggagaling talaga sa baga natin. Kaya pag nailabas yan, if there would be cells of cancers in the area, maaaring makita doon sa cytology. Linalagay sa isang slide, inaayos or dinidip sa mga iba't ibang mga fixatives at pagkatapos tinitingnan po sa microscope. And what else? Biopsy, nabanggit ko nga kanina, ito ang gold standard kung paanong ma-determine kung ang isang bukol ay cancer ba o hindi. And there are a lot of ways in doing biopsy. Biopsy is simply what the laboratory does, yung mga histopathologic studies yan ng biopsy. Pero ang tanong, paano kukuha ng sample para ma-biopsy? Iba't ibang mga pamamaraan. There is what we call your CT-guided biopsy. And what do we do here? Yung nakita nyo kaninang CT scan na pinakita ko sa inyo, may area, CT-guided, ibig sabihin, nasa CT scan area sila, minamarkahan yung lugar na may posibleng bukol at pagkatapos sinusukat yon. At pagkasukat, tinutusukan ng karayom at pagkatapos kumukuha ng sample from there. That's CT-guided biopsy. On the other hand, there's transbronchial biopsy. Ano ibig sabihin to? Mayroong tinatawag na bronchoscopy. Ibig sabihin, it's actually an endoscopy, parang gastroscopy at colonoscopy na ginagawa sa bituka. At yan, ito naman ang tinitingnan yung baga mismo, yung daanan ng baga. At kung saan man abutan na mayroon nakikita mga bukol o mga lesions o questionable areas, that's where they do get the biopsy from. And last would be fluid cytology. There are cases that might be having fluid present in the lungs. Kinokolekta ito either by thoracentesis or by tube na tinatawag na thoracostomies. At pagkatapos yung tubig na nakukuha, buong-buo yan ipinadadala sa laboratorio at dun sila kumukuha ng sample. But point being, it's to look into the slide ng ating mga kaibigan na pathologists to find out kung may mga cancer cells ba o wala. Now, what do we do for treatment? For non-small cell lung carcinoma, well, kung maliliit lang yan, we do surgery. We take out the lesion or we take out the lobe. Kaya may tinatawag lobectomy. We have 5 lobes of lungs. Sa kanan, 3. Sa kaliwa, 2 lang. At bakit 3 at 2? Is because yung puso natin nasa gawing kaliwa. Kaya yung space kung saan nandun yung puso, yung katapat niyan, nandun yung middle lobe ng kanan. Kaya ang kanan 3, ang kaliwa 2 lang. We can actually take out one of those lobes kung nandoon yung bukol at apektado lahat. As a matter of fact, yung iba nga buong kaliwa ba o kanan na baga ang tinatanggal. As a matter of fact, worst case scenario, we could leave just one lobe lang talaga kung talaga naapektuhan ang buong baga. On the other hand, if medyo malawak na ng kaunti, then we combine this with chemotherapy and radiation therapy. That's for non-small cell lung cancers. But if you notice for small cell lung carcinoma, nawala na yung option for surgery. Why? Because more often than not, by the time we do determine that lung cancer is small cell in origin, the possibility of metastasis meron na. That's the reason why we no longer do surgeries and we just do chemotherapy and or radiation therapy. Now, of course, chemotherapy, we've all seen at one point in time patients undergoing chemotherapy and radiation therapy as well. Of course, there are new drugs. I won't tackle a lot of this anymore, but there are a lot of inhibitors para medyo mabawasan yung paglala, pagdami at pagkalat at paglaki ng bukol. These are what we use for chemotherapy. But, prevention is still the cure. So point being, do not smoke. If you haven't tried it, don't try it na lang. At kung ikaw ay naninigarilyo naman, medyo isip-isipin na kung paanong itigil yan. Singapore, hi Ma'am Lila, sana makapunta na tayo dyan, is quite strict about no smoking in anywhere, in any place. Dito sa Pilipinas, buti ganun din naman ngayon kasi may mga laws that have been passed that you can no longer smoke in public basta-basta. Kaya nga may mga isolated areas na lang. Hindi katulad nung unang panahon na merong non-smoking, may smoking areas. Ngayon, most of the areas are non-smoking. Maliit na lang yung lugar and in open spaces yung mga smoking areas and hindi ka na pwedeng manigarilyo sa mga public transportation, sa kalye habang naglalakad ka, bawal ng mga naninigarilyo. You are now confined to a small area, which is actually good kasi napipigilan na manigarilyo mga tao. Plus, I think one of the minimal good things that has happened to us because of COVID-19 and the pandemic is that because everybody is wearing a mask. One, hindi ka basta-basta maninigarilyo. Siyempre, nakamask ka, alam naman isingit mo sa mask mo. On the other hand, kung mayroon naninigarilyo o nanigarilyo, abay, hindi mo basta-basta malalanghap kasi nga naka-mask tayong lahat. Now, tobacco use is a known or probable cause of death for all of these respiratory diseases. Andyan si tuberculosis, si pneumonia, si influenza, bronchitis, and lung cancer, of course. Worst case is, hindi na nga lang sa pangkatauhan, sa paligid, maaari magkaproblema pa dahil sa paninigarilyo. Sunog po, marami ng mga sunog na pinagmulan ay ang kakapiragot na sigarilyo na hindi napatay, nakatulugan, nalaglag, dumikit sa kurtina o sa mga tela na kung saan madaling masunog at lumiliyab na in the long run. So magkakaroon pa ng iba't iba pang problema, hindi lang pang katawan, kung hindi sa environment as well. Now, Environmental tobacco smoke or your ETS or your passive smoking, ito nga yung binabanggit natin kanina. It basically contains the same carcinogens and toxic agents na parang i-inhale ng naninigarilyo. As a matter of fact, sinasabi ko pa nga, mas dehado pa yung second-hand smoke kasi yung naninigarilyo may filter sa dulo kahit katiting yun maski pa paano may filter. Hindi katulad ng second-hand smoke na hindi mo ma-filter. Kaya nga sabi ko mabuti na lang at karamihan sa atin ay nakamask na yung mga panahon na ito. Kaya nga mas nababawasan yung pagkakataon makalanghap na sigarilyo. At sa totoo lang, the carcinogens in cigarette is not just in the smoke per se. There are studies that have been found na, kunyari, nanigarilyo ako, tinigil ko na yung paninigarilyo, tumigil ako at pinatay ko na yung sigarilyo ko. Yung ibang carcinogenic components kumakapit sa damit natin. Kaya kapag tayo'y umuwi na sa bahay, hindi agad-agad na palit, mayroon po tayong pagpaligid na natin na may bahay na buntis o di kaya may mga maliliit na bata, maaari nilang malanghap galing sa inyong mga damit itong mga carcinogens na ito, giving them problems at an early age. That's why there are asthmas in young individuals. At masaklap, humihina ang baga nung baby na hindi pa pinapanganak. Kaya yan yung mga ibang mga problemang gusto nating maiwasan. Yan yung mga nababanggit natin dito, yung aggravated asthmatic conditions, pati yung blood circulation apektado, pamamaga ng daanan ng hangin, yung mga bronchitis, at infection like pulmonya. At pagkatapos, hindi lang yan, irritated ang mata, ang ilong, at lahat ng bagay na ng katawan hanggang lalamunan na apektuhan, they are also irritated. And the increase in the risk of lung cancer and heart diseases in healthy adults increases 20 to 30%. Ngayon, nabanggit ko kanina yung mga bata. 60% might suffer acute upper and lower respiratory tract infection. Development of asthma, tumataas. Sabi ko nga sa inyo, nag-i-impair yung lung function lang. Bakit? Hindi pa kasi ganun ka-fully developed. Kaya nga yung mga bata, pinuprotektahan talaga natin yung mga yan. Yung mga buntis na nagdadalang tao, gusto natin maprotekta dahil pag pinanganak na nila ang kanilang mga anak, yung unang ihip ng hangin, kailangan maayos yung baga maski papano dahil kung mahina siya, umpisa pa lang nagkakaproblema na. Of course, increased frequencies of middle ear infections which can lead to reduced hearing, and there is what we call SIDS, or your sudden infant death syndrome, and we've discovered that your pulmonary problems actually play a vital role. Kaya nga, yun yung binanggit ko kanina na hindi pa pinapanganak. Paglabas nila at pagkapanganak sa kanila, dapat yan yung hangin pumasok bigla. Paano kung hindi ganun ka handa yung baga para makatanggap ng hangin? Kaya nagkakaproblema. And sometimes, in the long run, might have your sudden infant death syndrome. Now, paano ba natin matutulungan tumigil panigarilyo ang mga tao? Of course, dalawang bagay yan. One is, I do remember my grandfather long ago dropped it like cold turkey. Yan na yun. Tigil siya. That's it. That's it, pansit. Sinabi niya yun na yun, ayaw na niya, tigil na. At hindi na siya nanigarilyo hanggang sa dulo. But for a lot, because of the nicotine component, it literally is quite difficult. So here are some tips that we can help you with. You set a quit date. Kumbaga may deadline ka. Para nang sa ganon, may idea ka na, sige, pagbigyan na natin, hindi mo kaya ngayon pero tingnan natin, kailangan may date ka. At yung date na yan, ipaalam ninyo sa mga kamag-anak, kaibigan, mahal sa buhay, kapamilya, etc., 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 para masubaybayan nila yung pagtigil ninyo. Sometimes we would ask them to chat down and record yung kanilang paninigarilyo kung nakakailang stick o worst case na nakakailang kahaba para lang mamonitor kung gaano ba talaga karami. At paminsan, change your smoking routine. Ibig sabihin, kung kayo'y bumibili lang kunyari, dahil merong sari-sari store sa tapat ng bahay ninyo o sa tabi ng bahay ninyo o sa baba ng bahay ninyo, medyo pahirapan ninyo yung sarili ninyo kung saan kayo bibili ng sigarilyo. At pangalawa, kung saan kayo basta-basta maninigarilyo. Because kung yung mga bagay na ito, you find it difficult in purchasing cigarettes because the price nowadays, hindi nila paminsan pinapansin yan eh. But the method and ways of actually getting hold of a cigarette, if you make yourself, difficult just to get one, hoping na in the long run, tumigil ka na rin manigarilyo kasi medyo pahirapan, di ba, nakakapagod. Of course, some would say switching brands that you might find distasteful just so as mag-iba yung iyong method or yung iyong nakasanayan, which means kung menthol, non-menthol, para tumigil ka. And what I often tell my patients, sige, you cut down the number of cigarettes you smoke. You smoke a pack in a day, okay. Let's do it on a weekly basis. This week, half a pack ka na lang. Week after that, half a pack. Hanggang sa dulo niyan, from 5 sticks to 4 to 3 to 2 to 1. So siguro in the next 3 months, kung hindi kaya ng isa o dalawa, tumigil ka ng manigarilyo. What else? Don't smoke automatically. If you have a particular brand, make it difficult to find, katulad na sinabi ko. At huwag basta-basta sigarilyo lang for the sake of maninigarilyo ka. And ginabanggit nga natin, make smoking inconvenient. Abay, huwag kang bibili ng kaha-kaha, karton-karton o rim-rim. Paisa-isa na lang. Para lang tumigil ka. Because if it's readily available for you, you buy 1 or 2 rims, ilang kaha yan, abay, nandyan lang. Any given time, pwede kang kumuha. Talaga hindi ka titigil basta-basta niyan. Now, the last one, I actually had a couple of patients do this on their own and they eventually stopped smoking. Collect all your cigarette butts in one large glass container as a visual reminder kung gaano talaga kayo karami at kung gaano kalakas manigarilyo. I did have a couple of patients, ang ginamit nila hindi nga glass container lang o bote. If you're familiar with, I'm sure some of you might have had a chance, yung mga jelly na maliliit na naka-cups na binibili. And di ba when you do buy that, you buy them in this huge 2 to 3 liter gallons or 1 gallon na lalagyan na malalaki. Talagang malaki yung mga yan kasi iba ginagawa ng lalagyan ng mga kung ano-ano pa mga bagay. I did have these 2 patients that in a span of less than 2 weeks, actually isang linggo nga lang, akalain mo na puno nila yun. Ganun kalaki yung lalagyan na puno nila, which means ganun sila kalakas manigarilyo. Yung isa took a while bago tumigil, but the other one, seeing it, kasi bit niya sa clinic, sabi niya, Doc, titigil na talaga ako manigarilyo. Kasi ito lang yung sinigarilyo ko the whole week, pag dala sa akin nun. Sabi ko, 1 linggo lang yan. Opo. Not even counting yung nasa labas siya na tinapon na lang yan sa basurahan. Ito yung nandoon sa bahay niya. And realizing how much cigarettes that he's actually consumed just in the past week, plus giving all the problems that he's actually experiencing, made him want to stop cigarette smoking. Now, ano pa ba? Kung meron katapon mo na nga, simple lang yan. Like I said, change your routine. You can use other things because most of cigarette smokers develop an oral fixation, meaning kailangan meron sa bibig, meron even hawak sa kamay. Kung kaya't pwedeng gumamit ng mga candies, gums para may nguyain. Yung iba may mga sticks na hinahawakan lang para lang medyo ma-distract sila kasi nakasanayan nga nilang mayroong nasa bibig nila at mayroon silang hawak-hawak. Though, let me just caution, kasi nga kung talaga mga candies at lahat, we usually would recommend mga sugar-free ones because the likelihood naman tumaas yung sugar content niyan. Baka lumaki, tumaba, lumobo at tumaas pa ang asukal ninyo sa katawan. And of course, para kayong bata, reward yourself at the end of each day for not smoking. Di ba, yung mga bata, o gawin mo to, wag mo tong gawin, may premyo ka sa akin sa tapos ng araw. You can do that to yourself. Para mong linoloko lang yung sarili mo. But let me show you the benefits of quitting smoking. Of course, sabi ko nga, the effects, it really takes a while bago mawala. But here are some based on the hours, days, and months. 20 minutes. Kasi yung iba, di ba? Imagine, if you're smoking a whole pack in a day, that's practically sunod-sunod. But 20 minutes of stopping cigarette smoking, your blood pressure and pulse rate returns to normal. Your blood circulation improves in your hands and feet. Yan yung mga distal extremities, kaya nga nagmamanhid-manhid yan kuminsan. Of course, in 8 hours time frame, your oxygen levels return to normal and your chances of a cardiac attack decreases. Sa maghapon, tumigil ka ng paninigarilyo. Carbon monoxide is already eliminated from your body. And at this point in time, your lungs start to be clearing out of all of these mucus and other problems that can contain, affecting the capacity to have oxygen in them because it's irritated at napupuno. Imbis na hangin, plema ang napupuno. Now, 48 hours after, in 2 days, nicotine is no longer detected in the body and your sense of taste and smell actually improves. Longer pa. Tumagal na. 3 days na. 72 hours. Breathing becomes easier because your bronchial tubes actually relax, and because of this, your energy level also increases. Now, tumagal na. More than a week, 2.5 weeks. Your circulation improves throughout the body. Your ambulation, like walking, also becomes easier and is improved. Humaba na. Umabot na ng buwan. 3 to 9 months. Your problems like shortness of breath, wheezing, they all improve. And even your lung function increases by as much as 10% by this time. Now, naging matyaga ka, hindi lang months, umabot na tayo ng taon. In 5 years' time, your risk of a heart attack falls about half of somebody who doesn't smoke anymore. So, nababawasan yung mga possibility of cardiac effects. And of course, doubling that in 10 years time frame, the risk of lung cancer also falls to about half doon sa kapareho ng mga hindi naninigarilyo. So, the risk of a cardiac attack decreases likewise. Doon na ikukumpara na natin halos pareho sa mga taong hindi naninigarilyo. Now, what else we can do? We've been talking about smoking, we've been talking about the environment, we've been talking about everything else that is pertained to lung carcinoma. Like I mentioned, there are modifiable, there are non-modifiable. Smoking is one of those that are actually very, very much modifiable. But what else can we do? We have to make sure our bodies are fit, are strong, are clean enough so that the likelihood of carcinoma doesn't set in. When I'm always asked about cancers, in reality, all of us have the possibility of cancers. Why? Because in reality, cancers are simply cells that are found in an area that's not supposed to be where they are seen. What does that mean? Ibig sabihin, breast tissue that might be found in liver, or ovarian tissues that might be found in the stomach tissues that might be found in the intestines, prostate lesions that might be seen in the brain, lung tissue that can be seen in other parts of the body. Which means, kung tayo mahina-hina, mga ito lalago doon sa mga lugar na hindi sila dapat nandoon. Kaya nagkakaproblema. That's what cancer is all about. So the question now is, we have to make sure that our bodies are really strong enough so that it won't have to give a chance for any other cells na tumubo sa katawan natin. So, we clean up. That's what cleanse is for. We detoxify. And with the beauty of cleanse, we just don't have insoluble fiber. Yan yung tunay na fiber. Yan yung lumilinis sa ating mga bituka. But it also has soluble fiber. Why? Because ang itsura po ng bituka natin, sabihin natin, Dok, teka, ba't napunta sa bituka? Di ba baga pinag-uusapan natin? Yes. But the nutrition para mapaayos ang katawan natin also comes from the food we eat. And that passes through our gastrointestinal tract. Kung kaya't ito ang kailangan natin linisin. Because sa baga, ang pumapasok dyan yung hangin, yung oxygen na dinadala sa buong parte ng katawan. Pero para patibayan ang katawan, kasama ang baga, kailangan na nutrisyon yan. Nakukuha sa kinakain natin. Ang tanong, does our body actually able to absorb all the nutrition that we take in and eat? Or sa dumi ng bituka natin na isasama lang doon sa nailalabas natin pasintabi man po doon sa mga kumakain na. So that's why soluble fiber is also important because all the nooks and crannies of the areas, lalo-lalo na yung malaking bituka natin or the large intestines, pumapasok yan para sumusuot sa mga kanto-kanto, nalilinis para rin bahay natin yan. Di ba yung mga sulok-sulukan, hindi naman basta naaabot ng walis o ng mapya mga yan. Yung iba kailangan talaga linilinis, sinusuyod, binabrasan pa natin yung mga kanto-kanto. Yan ang trabaho ng soluble fiber. Now, point is, when we detox the colon, we actually have a healthy colon. And with that healthy colon, we now prevent diseases. Kaya na nabanggit ko, di ba? Pag humina yung baga, nagkakaroon ng posibilidad na magkaroon ng problema, viral, bacterial, fungal. But if our colons are clean, natutulungan din natin patibayan ng katawan natin. That's why we prevent sickness and diseases. Now, here's the thing. Pansinin nyo, pagka nagkaroon ng pagkakataon kayo, bumisita o kayo mismo nagkasakit, di ba? Anong mapapansin natin? Abay, 2-3 araw lang pag tinignan natin sarili natin sa salamin o di kayo yung mga kaibigan natin, makikita natin kahit sa video na lang kasi nga, di ba, hindi na ngayon nakakadalaw sa mga hospital basta-basta. Sasabihin natin, parang tumanda yata. 3 araw pa lang naman nagkakasakit. That's because metabolism is at its peak to augment and compensate for the trouble that the body is in, kung kaya't mabilis na parang tumanda. So, balik na rin natin. Ayusin natin ang katawan natin, ayusin natin ang mga bituka natin, linisin natin ang mga bituka natin. It actually slows the aging process. That's actually the anti-aging component of detoxification. But of course, it just doesn't stop in detoxification. Siyempre, naglinis ka, anong gagawin mo? Ayusin mo yan. Parang bahay natin, di ba? Pagkalinis yan, nag-general cleaning ka, dapat yan, ayusin natin ang mga lugar natin. That is now where we do mega nutrition. And we usually would recommend cryptomonidales with natural PPARs. It's recognized by experts as one of the most promising health food in the 21st century. Actually, this is an old slide kasi hindi na siya most promising. Promised na kasi 21st century na. And it's been researched by the world's most prominent medical doctors, and the guy who's developed it is that guy with a smiling face in front of you, Professor 𝐸𝐽, where he actually created this plant in Taiwan. And such a jolly fellow, sometimes having difficulty in English, but later we'll show you. So what's cryptomonidales? It's actually a primitive structure with no cell membrane, with rich amounts of ribosomes and all of the other things. And literally, they're just algae. Algae, in other words, lumot. Pero, hindi yan yung just because umulan lang kahapon at medyo linumot yung gilid-gilid ng inyong pader, kukunin natin, titik-tikin natin yan, sasalak, lalagay sa capsule, bibigay sa inyo. Hindi po. They're a specific type of algae, the blue-green algae, which is actually full of essential nutrients, which we will show in a bit. Now, let me show you Professor 𝐸𝐽. This is in Taiwan with the VATS. Ayan yan. Hindi ho swimming pool yan. Mababaw lang yan. They're just practically around 3 feet. That's where they cultivate cryptomonadalis. And they used to have just like 3, but eventually they expanded 5, 8, I think, if I'm not mistaken, Ma'am Lila, 12 to 15 na yata ang VATS na ganyan. Ganun na karami in Taiwan. We know that because, well, ayan po tayo, kasama ho natin siya. Dinalaw po natin because we wanted to see and find out how everything else is actually done, the system of how it's made, and how we actually get it in the long run. So, paano nga ba? Magmula dun sa VATS, kinukulikta siya sa isang napakalaking lugar at iniipon. Yan yung nakikita nyo. Kaya po yan, blue-green, halos greenish yung nakikita niyo. It's because all of the algae collected in these vats where they cultivate them, dinadala po dyan. At pagkatapos, sinasala ng mabuti. They actually now concentrate things, remove debris and all of the other things that are not algae. And the best thing is to actually differentiate a cryptomonadalis versus other forms of algae. Kaya you'd notice that yung mga tubes na to concentrated na dark green because they're now collecting pure grade cryptomonadalis. And there's several vats in doing that. Sunod-sunod yan, the process of actually cleaning it so that when when it reaches the end, you are now having collected very much pure forms of cryptomonadalis. Afterwards, syempre basa siya, di ba, algae nga. So we dry them up. And once it's really dried, they're now put in sacks like this one in a carton in your right-hand side. Hawak po natin yan. Ayan po yung kamay natin. Pati yung bracelet natin pa. So, hawak-hawak natin yung powder form. But it doesn't stop there. Why? These dried up cryptomonadalis are now sent into the packing station. It's actually compressed into tablet forms. For those who actually use cryptomonadalis, you actually notice these tablets are rather coarse and they're not fine. As a matter of fact, if you try to, parang dinudurog ninyo, nadudurog siya, it's because the tablets of cryptomonadalis is just that. It's cryptomonadalis, nothing more, nothing less. So they're in a compact, very compact form. Iyan na po yung nagagamit nating mga in tablet form. So let me just show you this slide. I usually want to show this one. On your left-hand side is chlorella, because chlorella is quite common and quite popular. May mga other components for nutrition and immune boosters. So if you notice, they're actually circular and rather dark yung edges. They're not really dark, but if you look at closely, they're actually spicules. Kaya siya mukhang makapal. And it really takes quite some time for them to be absorbed because of these spicules. In contrast, on your right-hand side, if you notice your cryptomonadalis, they're oval. They're quite fine in the edge because they're easily absorbed. They just diffuse to the areas where they are needed and absorb. So this is the team that actually went to Taiwan. Andiyan po si Ma'am Lila, nasa harapan ko. At iba't ibang mga doktor na kasama natin with Professor Wangsun. So the nutritional profile of cryptomonadalis, if you look at your left-hand side, you have the 3 macronutrients. You have your protein, your carbohydrate, and your fat. But wait, there's more. You have fiber, your chlorophyll. You have chlorella growth factor. Yun yung sinabi ko kanina. Ang pinakamaganda, chlorella na nakikita natin is actually a component found inside your cryptomonadalis. Of course, you have your RNA and DNA. But wait, there's more. You have vitamins. A, the B complex. You have C, your E. You have provitamins. You have biotin. So, napakadami at kompleto ng bitamina. Again, but wait, there's more. They also have minerals like your potassium, which is one of the most important electrolytes that we have that is needed in the body. You have your magnesium, lalong-lalo na itong panahon ni COVID. You have zinc, which is actually very much needed. And then iron. I do give it to my patients who are actually relatively anemic. Medyo mababa ang kanilang mga hemoglobin, hematocrit, and red blood cell counts. Ito, dinadagdag natin sa kanila para mas tumaas. Dahil maliban sa iba't ibang makikita natin nutrients, it contains a high amount of iron. And yung unang-una dun sa taas, as an orthopedic surgeon, that's one of the most important things na ibinibigay natin. Calcium. Lalong-lalo na dun sa mga hindi nakakainom ng gatas dahil may problema or lactose intolerant or ayaw lang talaga uminom ng gatas. Iyan yung binibigay natin ng option because it basically has a certain amount of calcium that is tantamount to a glass of milk. Kung makikita niyo, 290 to 325 milligrams. Ang isang baso po is anywhere from 250 to 300 milligrams of calcium. So halos pareho na. Though, kung makikita po ninyo doon sa baba, hindi naman ganyan karami ang binibigay natin. Usually for a daily basis, we just give around 5 tablets in a day. But once may problema na, because yung nutritional component bumabagsak, mas tinataasan natin ang pagbigay sa kanila. So that 5 tablets, we might give them not just once in a day, but twice in a day, or even 3 times a day, lalo na for some patients who are having problems of carcinomas. Then we give them as high as 5 tablets 3 times in a day. Although, isa sa mga binabantayan ko personally is yung kanilang kidney function or renal function. Kasi nga, dahil sa laman na protina nito, baka magka-problema kung sakasakaling bumabagsak na yung kondisyon ng kidneys o di kaya ay nagda-dialysis na. Now, the effects, there's PPAR, we'll discuss that in a bit, which aids in carcinomas. Your chlorophyll, which is blood purification with an antitoxic effect, and it provides abundant energy. Kasi nga, nandiyan si chlorella growth factor and the RNA and DNA. Now, let me just show you this. It's an old article, March 2009, Exercise in a Pill. This is in the United States. Alam niyo naman sa US. Medyo kung pwede lang nilang inumin, para hindi nila gawin, gagawin nila. So, they actually have developed a pill that will minimize fat component and in replacement supposed to be of exercising. But if you notice dun sa gawing baba, asa na ba aking marker? There you go. Professor Ronald Evans, siya yung nagsulat at nag-research nito, found the drug GW1516 is actually activated by your PPAR delta. The component is it results in improved resistance to weight gain and insulin response. Plus, of course, the training, bumababa ang kanilang mga timbang. The thing is, this is 2009. Sa totoo lang, ilang taon na ang Noblelife. Medyo matagal-tagal, mas matagal-tagal pa kasi na-discover na natin na una pa bago nila na isulat dito. Now, what's PPAR? Peroxidome proliferator activator receptor. I know it's a mouthful. It took me a year to actually pronounce it properly. But it's actually just that, a receptor. Ibig sabihin, siya yung nagre-receive ng kung ano-ano mang kinakain natin, nutrisyon na nanggagaling sa pagkain natin. And it transcribes it. Kaya, eventually, nagkakaroon tinatawag na cell differentiation, development, at inaayos niya yung metabolismo ng carbohydrates, fats, and proteins at naipapadala niya kung saan mas kinakailangan. I usually would give the example of our highways. Dito sa mga nasa Pilipinas, ang ating NLEX at SLEX. Diba? Ang uso ngayon, meron kang auto sweep, RFID, or easy trip. Yan yung mga nasa-sense or may mga sensors rather na tinitingnan para ikaw dumaan ng toll gate. Bakit? Ang trabaho kasi natin dyan, pagka dumadaan tayo, gagamit tayo ng highway, syempre dadaan ng toll gate. Pag tumaan ka ng toll gate, abay, magbabayad tayo, susuklian, bibigyan ng ticket bago makadaan. Ang tanong, gaano ba kahaba ang pila bago natin magawa yan at makatawid tayo para magamit ang highway at makapunta sa mga patutunguhan natin. Medyo matagal, lalo-lalo na sa mga peak hours or even peak seasons. Now, on the other hand, for those who have your auto sweep or easy trip RFIDs, what happens? Abay, tuloy-tuloy ka lang. In a span of a second, mababasa yung iyong strip sa kotse at syempre, kailangan may laman yon. Kung may laman, in that second, bubuksan na niya yung boom ng toll gate, dire-diretso ka. No hassle, no traffic, no time wasted. Parang ganyan din kasi si PIPAR. So, nakukuha na niya lahat ng posibleng nutrisyon na kinakailangan, tina-transcribe niya, at pagkatapos ipinadadala na niya kaagad kung saan kinakailangan para kang dumaan sa toll gate na naka-RFID ka. Hindi na mag-aantay, hindi na magpoproseso na napakatagal, kung saan kailangan dadalhin niya doon at i-develop para doon sa lugar na yon. So in this case, if we do have problems in our lung fields, then doon siya nagpapadala ng nutrisyon agad-agad kasi kinakailangan ng katawan ng isang taong may lung cancer. Now, there are PPAR agonists, natural ligands. Pansinin nyo lang itong mga mukhang hanger na ito. Ay may kahalagahan yan maya-mayang kaunti pag in-explain natin. So this is just actually a schematic, na yung ligands, kinukuha lang yan at nade-develop yan at pagka-metabolize, ina-absorb ng PPAR at pagkatapos tinatranscribe at binibigay, pinadadala sa kung saan nangangailangan. At ano mga epekto nito? The biomedical effects could be either active or repressive, which means inactive dahil sa nangyayari, napapaganda niya yung metabolismo ng mga taba natin, yung mga lipids na tinatawag. At the same time, na-maintain niya at stable level ang asukal natin sa katawan. At gaya nga nabanggit ko, cell differentiation, kung saan kinakailangan, doon mas binubuhos yung mga nutrisyon na kinakain natin para ma-develop kung ano man pangangailangan meron ng katawan natin. That's cell differentiation. On the other hand, repressive, because sa lahat ng nangyayari yan, nagkakaroon ng anti-inflammatory properties. What's anti-inflammatory? Hindi po yung basta namaga na para kang kinagat ng ipis na maga yung kamay mo. Hindi po. But in any problem that we may have in our bodies, there is always an inflammatory reaction that happens. Tumutulong siya para mabawasan itong inflammatory reaction na to para mas mabilis gumaling, mas mabisa yung paggaling. This just goes to show na with insulin levels, nababawasan kasi yung sensitivity, so yung long-chain fatty acids na nakikita sa atay at sa muscle natin, napakataas na mga yan. Napakataas din na nakikita sa serum free fatty acids, so eventually yung mga fat cells and adipose cells natin, ganun din. But on the other hand, because of what happens in PPAR, baliktad, they do attack our adipose cells wherein everything else decreases. And eventually, because of that decrease, the serum-free fatty acid decreases, eventually making the long-chain fatty acids seen in your muscles and in your liver decrease as well. Now, dun sa inflammation, gaya nga nabanggit ko kanina, di ba? Hindi lang yung basta pamamaga. Kung hindi yan yung kung saan may problema, mayroong pamamaga. So let's take your blood vessel kung kunyari, itong nasa harapan natin. So, ang blood vessel, ang mahalaga dyan, hindi naman kung ano ang daan ng dugo. Ang tanong is, maayos ba yung daloy ng dugo? Because kung magkakaroon ng problema o oberya, katulad nito mga atherosclerosis na tinatawag, tumataas yung pressure. At sa totoo lang, ano ngayon kung tumaas ang pressure? Hindi naman kasi problema yung pagtaas ng blood pressure. Ang problema, indirectly, kapag tumaas ang pressure, ano mangyayari sa blood vessel natin? Like any elastic thing, lumulobo. The question now goes to how and what is the caliber and quality of that blood vessel. Ibig sabihin, oo, lumulobo siya kasi tumataas yung pressure, hindi daloy na mabuti ang dugo. Yung ngayong pressure na nandoon sa area na tumataas ang pressure, yan ba'y matibay enough o yan ba'y may lamat na maaaring pumutok? So pag yan pumutok, ang tanong, nasaan yung ugat na yan? Nasa puso ba? Nasa baga ba? O nasa utak? O nasa iba't ibang parte ng katawan? Kaya nagkakaroon din ng strokes, nagkakaroon ng tinatawag na cardiac events. So, dyan ang gagaling yan. We cannot test blood vessels on an ordinary basis. Unang-una, napakamahal yan. Pangalawa, hindi namin talaga ginagawa yan. We only do that kung talagang may problema na sa puso at kung ano man other problems. But the easiest indirect way to actually examine is by checking your blood pressure. Yan nagagawa kahit saan man, kahit sa bahay ninyo, kahit health center, hindi kinakailangan sa ospital o klinika. Maraming pwedeng pagkunan ng blood pressure, which is quite easy. That's right. That's the reason why we actually, more often than not, check your blood pressure. At anong ginagawa nito? Directly, PPAR and ligans with activation of your PPAR, directly, pinapababa niya yung mga cytokines. Ito yung nakakasira sa area, yung chemokines, at pagkatapos yung paglabas ng cholesterol, ginagandahan niya. Yung paninikit ngayon na nangyayari, kaya nga nagkakaroon ng cholesterol deposits dyan sa loob, yung paninikit na yan, nababawasan yan, yung adhesion molecules. On the other hand, indirectly, gaya nga nabanggit ko kanina, yung asukal bumababa. At pag bumaba ang asukal, yung sensitivity sa insulin gumaganda. And because of that, yung ating fat components like your triglycerides, bumababa din. So, naalala nyo yung parang malahangir na pinakita ko sa inyo kanina. That's the biochemical equation for pioglitazone. That's also the same biochemical equation of PPAR. The difference is your pioglitazone, even your rosiglitazone, are actually all synthetic. They are very, very good medications. As a matter of fact, they are used. I even sometimes use them for some of my patients who are diabetic. On the other hand, who would be the best person to actually develop a natural congener of this pioglitazone and rosiglitazone? But the same guy, Professor 𝐕𝐢𝐬𝐿, he used to be working with Takeda, and he's the one who's able to develop the natural congener, which is our PPAR agonists. So, the reports on the effects of cryptomonadalis, it can reduce the levels of cholesterol and low-density lipoprotein in up to 15 to 20% in one single month. And of course, the regulation of your blood glucose and your glycosylated hemoglobin can go back to normal in 3 to 6 months. It can modulate immune functions like your contact dermatitis, psoriasis, and even rheumatoid arthritis. Sa akin, napakalaga niya na sa surgeon. Yung wound healing kasi, dahil syempre, uupira tayo, hihiwa tayo. Yung paggaling nun, importante rin. Kaya, iyan isa sa mga nakakatulong natin. It also has some antiviral effects. And the last one is prophylactic and therapeutic effects of cancer. Uulitin ko, hindi po ito gamot. So technically, it is not therapeutic. But prophylactically, it will make our body strong enough. And in that case, because it is strong enough, it decreases the risk of possibility for a carcinoma to develop. Kaya nga yan ang mga ginagawa natin. Let's just show some graphs. These are for arthritis and skin lesions. Yung mga nakikita po ninyo dito, yung bago gumamit, yung pain score, napakataas. Pero habang ginagamit, bumababa na po hanggang 3 na lang. 3 is halos, may nararamdaman ka, pero hindi na ganun katindi para tumigil ang kilos at galaw mo. Unlike that, when you reach higher than 5 or 6, even 7. Let me just show you a picture of somebody who's had psoriasis. Yan po yung nagsiscale yung balat. Abay, hindi lang po sa balat nagkakaroon ng problema, kundi sa arthritis din nagkakaroon ng kiruan. This was taken November, this was taken February. Kung mapapansin ninyo, mapula pa yung area, scaly, and definitely makati po yan. But in a span of 3 months, tama, November, December, January, February, abay, hindi pa naman natanggal, pero definitely nabawasan na yung areas, lalong-lalo na dito sa leeg, sa gilid ng tenga, di ba? Ganun din sa hita at binti. You see the lichenification of these areas. Dito, kaya nga nagkakaroon ng arthritis doon sa lugar. Etong kabila, medyo kumalma na, medyo nag-flatten out na, and definitely yung kirot nabawasan ng husto. Comparing PPAR and your tubulin, which is actually used for liver carcinoma, kung mapapansin ninyo, halos pareho ang kanilang electromyogram or electromicroscopic rather picture. But if you will notice in cryptomonidales, the difference is the effect. Halos pare-pareho nga, but with cryptomonidales, halos dumoble ang effect. And this is what I was talking earlier about. Cholesterol. Sa umpisa, 210, normal levels are supposed to be around 200 only. Aba, in 2 weeks time, nag-normalize na. In 4 weeks, mas gumanda pa. Kaya lang, pag isang buwan lang yung ininom niya, kaya pagkatapos nun, balik sa dati, mataas na naman. So it can actually help control your cholesterol levels. But when it's controlled, as much as possible, we would want to maintain it as well. So, like I said, that's PPAR research, liver, sa brains, sa puso, sa lahat, sa buong parte ng katawan natin. At pati na rin sa kidneys, the digestive tract, and sa, dahil lang cancer pinag-usapan natin, in types of injury and fibrosis, PPAR has mediated effects. Nababawasan yung pamamaga, yung edema, at yung paninira na nangyayari, yan yung fibrosis na tinatawag. And we'd just like to show you the prominent researchers that have been doing researches for cryptomonidales and PPARs, Professor Wang Shunten, Dr. 𝐿 Su, and of course, Dr. 𝐸𝐬𝐢𝐭. Dr. 𝐸𝐸𝐢 actually is the one who tried to study the researches that were done. Hinimay niya. And he was the one who said that the studies that were made were credible. So you have your local faculty, kasama po tayo dyan. At hindi lang po tayo limitado sa Pilipinas. Hindi lang sa Asia, kung hindi sa iba't ibang parte ng mundo, the UAE. We're now in Europe and hopefully, Ma'am Lila, pati sa US, sana mapasok tayo. Balita ko, inaayos mo na. And media and print coverage, media, it's quite easy. You have the budget to market it. You just pay airtime, space, or whatever, it's easy. But I just want to mention in China TV news, in China, hindi basta-basta nagkakaroon ng pagkakataon na bilhin mo yung airtime o bilhin mo yung space na paglalagyan mo ng streamer, poster, o billboard. But you have to apply properly to the Ministry of Health and for them to decipher if what they will be showing their countrymen is credible and true. The fact that it's actually seen in China TV news means that they have had an opportunity na pag-aralan at nakita naman nila na tunay at makatotoo itong mga pagsusuri na ginawa kung kaya't naipakita nila sa kanilang mga kababayan. So, it is not yet too late. We have to quit smoking and leave that pack of smoke behind. So I guess yan ang ating huling slide. Food is medicine. Sa totoo lang, palakasin lang natin ang ating mga katawan. Hopefully, mabawasan ang pagkakataon na sakit na dumapo sa atin. At kabilang na dyan, ang lung cancer. So I guess that's my last slide. I will now stop sharing. Maraming salamat po.
Ayan, thank you so much and set a quit smoking date. Ayun. Okay,
Yes.
thank you so much, Dr. Rylan Flores. This is a very impressive, informative afternoon for us to know lung cancer. And also with our product per se. Grabe, well-versed, ang galing, ang ganda. So, naintindihan ng lahat po ang ating produkto. At napakaganda po dahil nahimay-himay siya to the beat na Thank you,
Paano
Doctor.
may natutunan sila, ha? At kayo lahat.
Ayan, Doctor. Ayan, so, pwede standby muna tayo for our commercial. Then we're going back to short message pa ni Doc sa atin dahil may encouragement words pa siyang i-bilid. So, stay tuned for this commercial. Okay, there you go. So cancers are cells that are located where they are not supposed to be there. Okay? So, ayan, may mga maling pinupuntahan ng mga cells na to, nagkanda ligaw-ligaw sila sa katawan natin, no? And the solution here that we need is we have to have a healthy colon to prevent diseases and slow down our aging process. Ladies and gentlemen, expert po si Doc sa ating aging process na tinatawag. Ayan. So Doc, have some words of wisdom to us before we leave the place.
Yes, oo. Nakakatakot talaga na isipin natin that cancer might be a possibility sa atin or in any member of our families, friends, and relatives. But the idea is, before we think about so much na baka magka-cancer ako, let's do it the other way around. Let's make sure that we live healthily and, eat properly. 5 palagi sinasabi ko, eat properly on the right food at the right time, at pagkatapos uminom ng maraming tubig. Kung kaya uminom ng gatas, maraming salamat. Magkikikilos, bawal ang tamad. Kailangan we do our own exercises. Walking, if you cannot do at least exercises, do at least walking. Iwasan ang mga dapat iwasan. Kasama na dyan ang paninigarilyo, pag-inom ng alak at mga bawal na droga. At panglima, maipahinga natin ang katawan natin. We need to recharge ourselves as we recharge our cell phones. But there's actually a 6th. Kung hindi natin magawa, have Noblelife help you with
Ayun.
So, I guess that's my final word. And magpa-plug na lang ko na konti because I realize it's 6:30 already. Maya-maya pong 7:00. Pagkatapos po ninyo, kung hindi po ho kayo nagsasawang pakinggan ang boses ko, Facebook Live po, Doc Rylan, RYLAN lang. Maya-mayang kaunti at 7 p.m. I do hope to see all of you there as well in a bit. So I guess that's my last words for this evening. Thank you so much for giving us your time, for listening, for health. Thank you so much.
Okay, thank you so much, Doctor. And very informative yung araw namin. Punong-puno po kami ng lesson with our Dr. Rylan Flores. So guys, okay, so what we're going to do is to have discipline sa katawan natin, okay? Let's have discipline in everything we do. And kailangan po natin ang syempre, with the help of our Lord, na makita po sa puso natin yung pagbabago. Okay? So, thank you so much, everyone. And we don't have much time for this. And it's time for me to say goodbye and see you next Saturday for our next topic. We have Chat with the Doctor. Okay? We have a new, we have the new topic for that and so on. And kanina, we have all the announcements. And okay, so this is Johanna Incontro saying thank you so much and have a good day. Thank you. Bye.
Kahangahangang katangian ng isang mahusay na karunungan ay ang paggamit ng pinaka-natural sa mabisang produkto matatagpuan. Positibo sa lahat ng bagay, sa physical, emotional at spiritual, kasaganahan sa buhay, ang hangat dinuman. Ang kalusugan ay kayamanan. May kayamanan sa kalusugan. Pagkakataon, tulungan ang bawat isa, na ang bawat pamilya maiwasan ang karamdaman. Isang bagong henerasyon, harapin ang hamon ng buhay. May pag-ibig, tunay na kapayapaan, tagumpay at pagkakaisa sa lipunan. Ang kalusugan ay kayamanan. May kayamanan sa kalusugan. Ang kalusugan ay kayamanan. May kayamanan sa kalusugan. Ang kalusugan